Welcome back to a new episode of Ask the Patient Advocate podcast. Today we have a special guest who is making a real difference in the field of pelvic health and endometriosis treatment, Dr. Romeo Lucas. Dr. Lucas is a board-certified gynecologist and the founder of the New England Center of Pelvic Health. His mission is to provide care to patients suffering from pelvic pain and endometriosis with a comprehensive, personalized, and long-term approach to care, something that is often missed in traditional healthcare settings. If you or someone you know have been struggling with chronic pelvic pain, endometriosis, or related conditions, this episode is for you. We'll discuss why so many patients feel unheard, the challenges in diagnosing and treating endometriosis, and what true patient-centered care should look like. Dr. Lucas, thank you for joining us and welcome back to the show. How are you?
I'm doing well. Thank you. Thank you for having me today.
Of course. So, I know a lot of listeners from our last episode were really interested in your approach. So, I can't wait to dive into what's new since we last talked. But first, for those who may have missed our first conversation, can you give a brief refresher on what you do and what your advocacy is about pelvic health and endometriosis?
Yeah, sure. I'm a gynecologist practicing in Freeport, Maine. My clinic is the New England Center for Pelvic Health. We've been functioning independently for the last 2 years. And
Awesome.
yeah, it's a clinic that's dedicated to diagnosing and taking comprehensive assessment of the pelvis and the different systems and structures that live within the pelvis and how they can sometimes uh, not function properly and in turn cause dysfunction in related structures within the pelvis. And essentially, what we're doing is trying to look at the pelvis as a whole, but also step back and look at the individual parts and how they affect each other and get to a point where our patients have increased functionality, engaging in the activities that they want to engage in and getting people back to a fuller function in spite of dysfunction or even pain. And a lot of times that does involve endometriosis, but it's more than just endometriosis. And
Mhm.
sometimes it's not endometriosis at all. It's really taking a look at patients will sometimes come in and say, I really think I have endometriosis. And, after full examination, sometimes they don't. And it takes that sort of comprehensive, you know, sky high view of all the different structures and assessing where the dysfunction is and how to correct it.